Hello, my name is Lulu Becker and I am a physiotherapist with a special interest in pelvic and women's health. I help children who are struggling with constipation, incontinence and bedwetting here at my practice in Lulu in Durban. Constipation is the biggest cause of wee and poo leaks in children and bedwetting. But over and above that, we are seeing more and more children struggling with symptoms of anxiety as a result of being constipated. So 90% of our serotonin is made in our guts. Serotonin is responsible for feelings of well-being and happiness. So I often say to the mums and dads that I see here, it really is no surprise that a child who is full of poo can absolutely feel like shit. So today I wanted to talk about 12 signs that your child may be constipated, because constipation can be tricky to diagnose in children, yet the research tells us that between 10 and 20% of children are constipated. I feel like with doing the work that I do here, almost 100% of children are constipated, but hopefully after this talk you will be able to have a little bit more of an idea as to whether your child is constipated or not. So just as a quick reminder of how our digestive system works, we take a bite of food, obviously with our mouths, we chew, we swallow, and it comes down the throat and then into the tummy. In the stomach, the food is broken down and begins to be digested before coming into the small intestine, which is where absorption happens. But as I say to the children, not everything we not everything we eat is absorbed, and so the rest goes into the large intestine and is turned into poo. So the small intestine empties into the large intestine on the right lower side of your tummy, and then it comes up the right hand side and then across the base of your ribs and then down the left hand side of your belly. The stool starts as liquid, and then as it's coming down this descending colon, it becomes firmer as more and more water is drawn out of the poo before it comes to the rectum, which sits just above the anus. Obviously the anus being where the poo comes out at the end of the pipeline. So what should happen is that these walls of the rectum are nice and thick and they have good tone. And within the walls of the rectum, there are little pressure sensors that if they sense some poo in there, send a message up to the brain to say it's time to go and do a poo. Now at this point, you or your child decides, actually I'm busy playing now, I would rather just ignore this urge to poo, or decides, okay, I'd better go to the toilet and do a poo. So you would then go off to the loo, sit down, the child needs to be able to obviously get to the toilet on their own, take their trousers down, be able to get onto the loo, do their poo, and then wipe afterwards. Now, problems happen in children when they are ignoring that urge to go. So I joke that no children are pooing at school. Most children prefer to be pooing at home, yet often parents think they are pooing at school. So often children are delaying this urge to go to the loo. Now the problem that happens here is this rectum here is like a balloon. The first time we blow it up, it comes back down to its original size. But like a balloon, if it's repetitively blown up, then the walls of the rectum become large and flabby and weak. So thinking of like a balloon that's just been blown up too many times. The problem with that is then that because we don't have these nice firm narrow walls, we've now got this big saggy floppy rectum. The child isn't getting the urge to poo as well as they should be, and also when they go to the loo to go and do a poo, they aren't able to empty as effectively. The other problem that happens when we have an increased rectal diameter is that it puts pressure on its very close neighbor, the bladder, which is why constipation and a little stretched out rectum is the biggest cause of wee leaks in children, biggest cause of bedwetting, but can also be the reason that children struggle with fecal incontinence. Because when there's a large lump of poo and a stretched rectal wall at the end, The softer poo, remember we said the poo starts softer, higher up in the colon, and then the softer poo comes down, slides through this harder old poo, and then comes out as smears or leaks into the underwear, and usually the child has no awareness or sensation that this has even happened. So how and why do children get constipated? The biggest cause of constipation is what I've just discussed, which is what we call functional constipation. So functional constipation means there's no actual problem with the child's anatomy or physiology. The problem is that they've delayed going to the loo at some point because they perhaps weren't mature enough to be potty training, or they were somewhere they didn't feel comfortable to go to the loo, and then over time that rectal diameter stretches out and they stop getting the urge to go. Another huge cause is if the child has then, because of delaying going, gone to do a poo and it's been painful. So the research says it can just be one sore poo that makes a child associate pooing with pain. And the peak incidence we see for this withholding is around potty training between the ages of 2 and 4. And these are the children that the mums will say, I can see he needs a poo. He's going up on his tiptoes. He's squeezing his bum cheeks together or sitting down onto his heel, onto his perineum, because they fear going because they don't want it to be painful. These are often the children that we see that are quite happy to be doing wheeze on the loo or in their potty or out in the garden, but don't want to be pooing in the loo and prefer to poo in a nappy. So this is what we call functional constipation. So how functional constipation tends to happen is child has had the urge to go and do a poo, they've delayed it for whatever reason, so the poos have become firmer or harder because the longer the stool sits in that rectum, the more water is drawn out of it. So when they do go and do a poo, then it's really uncomfortable for them. So then the next time they need a poo, their little brains say, I remember how uncomfortable this was. I'm rather going to hold on. And it's that holding on over time that increases the width of that rectum. So ideally a child's rectum should be less than 3 centimeters wide, and when children come and see us here, we have a ultrasound where we actually measure the width of the rectum, and I've seen little children of ages 3, 4, 5 that have rectums that are stretched to 4 or even sometimes 5 centimeters, which is no wonder then that it's putting so much pressure onto the bladder, because if we think of the pelvis and it really is just a bony ring, and in a child it's so small, there's not much space for things to move. They're all tucked in very closely together, the rectum and the bladder there. So this functional constipation is responsible for 95% of constipation in children. So we know between 10 to 20% of children are constipated and 95% of them are functionally constipated. The other 5% have what we call slow transit constipation. So this is far less common, but these are children that actually have an anatomical or physiological reason why their bowels tend to work that much slower. These children tend to have been very constipated from early on as babies, whereas the majority of children that we see here are struggling with functional constipation, and the mums will say as newborns or little babies they had no problems at all with being constipated. Now, constipation is tricky to diagnose in children. Your child could be pooing 3 or 4 times a day and actually be really constipated. So today we are going to go through 12 signs that your child might actually be constipated. Number 1, poos that look like rabbit droppings or little balls. So ideally we want our children's poos to look like a number 4, so like a soft banana or sausage. Remember we were saying that the longer the poo sits in the rectum, the more water is drawn out of it, and the harder or firmer it becomes. So if your child is frequently having to have 1 or 2 stools, there's a good chance that they are constipated. Number 2, your child's having really wide poos. And often families will come here struggling with bedwetting or fecal incontinence, and I'll say, oh, I think your child's constipated. And usually the dad will say, no, you should see the size of the poos this kid does. There's no ways this kid's constipated. But remembering what we were saying about the rectal diameter, If the rectal diameter has been widened, it makes a bigger storage facility for the poos, and often I'll see children here that say that their poos actually block the toilet. So I normally say to parents, I don't want your child's poos to be wider than around 2 of your fingers. A very wide poo is an indication that those rectal tissues have been stretched out. Number 3, your child is doing really, really loose poos. So around here where it's looking almost like soup. The reason for that is it can again be if there is lots of stool sitting at the end of the rectum. So again, remembering we said higher up, the poos are softer, and so those softer poos come and then slide through the harder poos, and then can present as either very runny leaks into the underwear that haven't even been felt, or when the child goes, the stools are really runny in the toilet. Sometimes families will say it is a very runny poo that actually has like harder lumps of old clay in it too. Number 4, your child is having wee or poo accidents. So as we said, that increased rectal diameter makes a holding area, and I show children this picture and I say, does that bladder look happy or sad? And they all agree that that bladder looks very sad. And then I'll say what's happening is that the poo sitting in the rectum is actually knocking on the bladder, making the bladder hiccup and be unable to keep the urine inside. And then, as we've said also, constipation is the biggest cause of fecal incontinence because of that softer poo sliding through the harder poo and coming out as those leaks or smears in the underwear. Number 5, skid marks. Lots of families will say to me, no, I think it's because he doesn't wipe properly. Most often it's because the child is having little smears that it's creating the skid marks rather than that they aren't wiping properly. And families will often say to me, I actually just assumed he had pooed at school and that he hadn't wiped correctly, but I checked with him, or I checked with his teacher, and he hadn't actually pooed. It was just a leak or a little skid mark that he was having. Another one can be an itchy bum. So I think in South Africa we're quite good at looking to deworm if a child's complaining of itchiness around the back passage, but it can also be a sign of constipation. Number 6, if your child is having to push really hard to poo. So straining is usually an indication of a much firmer stool, or a stool that's been sitting there for longer than it should have been. And so this can be a sign that your child's constipated. I'll see lots of children who come and see me here and they'll say, when I'm trying to poo, my face goes red and I even have tears running down my face. And another cause for pushing really hard can be if the child's actually struggling to let go and relax their pelvic floor. So if we look at the muscles of the pelvic bowl that form the pelvic floor, and this is the rectum that comes down before it comes out of the anus, if we have had a lot of poo sitting in this rectum for an extended period, it actually weighs down the muscles of the pelvic floor, so the pelvic floor has to tighten up to be able to hold all the poo that's sitting in there, and then it can make it even more difficult for the child to be able to fully relax to do a poo when they are on the loo. Number 7, lots and lots of wiping. So it's one of the questions I ask children here. When you've done a poo, how often do you need to wipe? And I'm happy with around 2 wipes or maybe 3, but some children will say, oh my goodness, I feel like I have to use half the roll of toilet paper, or I'm almost filling up the loo with toilet paper. And that is again a sign of a increased rectal diameter and the child not being able to empty effectively, and so they're having to wipe repetitively because they're not getting a full empty. Number 8, and this is the one that can be so confusing, going to the toilet more frequently in the day to poo. So again, families will say there's no ways he's constipated, he's pooing 3 or 4 or 5 times a day. That for me is more of an indication of a rectum that hasn't been able to fully empty, and so that's why the child's needing to go more repetitively. So I'm always wary of a child who's needing to poo more than twice a day, especially if when they are pooing it's just little bits at a time that are coming out. Number 9, sore tummies. Constipation is the biggest cause of sore tummies, and I feel so often these sore tummies are being attributed to the child feeling anxious or not wanting to go to school, and then we have a check and we see that they really are full of poo. So anytime that there's a sore tummy, I'm usually 99% sure that it's down to constipation and not any other kind of emotional or behavioral problem. But as I said earlier too, with the majority of our serotonin being made in our gut, it means that being constipated often does make us feel a little bit anxious or unsure too. Number 10, bedwetting and accidents. Most of the children that we see that are bedwetting at night, it's because they are constipated and because of the stool pushing down onto the bladder. Number 11, toilet training trouble. I feel like the constipated children that I see here fall into two camps when it came to potty training. The first lot, the mums will say it was impossible to potty train him. He just never seemed to get it, or she just never seemed to manage. And that is because generally the child has gone into toilet training constipated, and it just makes it so much more difficult. These children tend to have more urgency and frequency, and very often the ones that are just frequently pooing in their pants, it's not because they can't be bothered to go to the toilet, it's because they actually are constipated to begin with. So I tend to see the ones that just never got the hang of toilet training, or the other camp are the ones that I see that the parents will say, oh, they got toilet training like this. Never had one wee leak, never had one poo leak, and these are the ones that are generally very good at holding. And it all goes well with the holding initially, but after 2 or 3 years, we tend to see that that stretch in the rectum really starting to affect things. And also, if they've been holding their wee in for a really long time, then it can actually thicken the walls of the bladder over time and make that bladder more likely to be overactive and contribute to wee leaks in the future too. Number 12, recurrent UTIs and lots of wheeze during the day. So if you have got a rectum that's full of stool, plus a bladder sitting just in front of it in this bony ring of the pelvis, and every time you go and do a wee, because of where the rectum is pushing onto the bladder, you aren't able to get a good enough empty, this child will then frequently need to go and do lots of wheeze in the day. So I'll sometimes see a child here at 10:30, 11 in the morning, and I'll say, how many wheeze have you done today? And the mum will say 9, 10. And ideally we want children doing between 6 and 8 wheeze in the day. So a child that's having to rush very urgently to go and do a wee, or some mums will say, oh goodness, we even have to carry a bottle in the car because if we're on the highway and they're desperate to wee, that is often a sign that they are constipated. But also if they are needing to do multiple small wheeze during the day. Something I also ask children is I'll say, when you're doing a wee, does it sound like your wee goes psh, or does it more go psh, psh, psh? And we want the first one. We want that steady flow rather than that stop-start, just because the stop-start can be an indication that there is stool sitting there and not allowing the bladder to empty effectively. And again, it can be that those pelvic floor muscles have got too tight, as we said just now. And then recurrent UTIs in girls. If you think of where the urethra is positioned relative to the anus, if a child, especially in the girls, if they have been constipated, then it's very easy for that E. coli to just travel up that short distance along the perineum towards the bladder. So if you have a little girl who is frequently struggling with bladder infections, please make sure that they aren't constipated. So, what can you do if you've been listening to this and think that your child might be constipated? Please check their water intake. So I like children to be drinking 30 ml of water per kilogram of their body weight during the day. Check how much fruit and veg and what their fiber intake is like. We tend to want to avoid bananas, peanut butter, marshmallows if they are prone to being constipated. I want you to ensure that they are using a footstool when they do a poo, because Mother Nature made us to squat on the floor to poo and not sit with hips and knees at 90 degrees. If we're sitting on the toilet normally, as I explained to the kids, we've got to push the poo around the corner because this muscle's tight. If we have our feet on a footstool, so our knees are higher than our hips, this muscle can relax and it's easier for the poos to come straight down. And then the very last thing I want you to be aware of is please ask your children every day if they've done a poo. I say please even ask your teenagers if they've done a poo in the day. And if they haven't, make it a part of their evening routine that they go and sit on the loo before bath, after bath, to try and do a poo. Just because the majority of children will prioritize playing over honouring that urge to go to the loo, and it can be a really effective way of ensuring they've done a poo each day and avoiding constipation in the long term. Thank you so much.